Hi members, Joseph here, UCU branch Vice Secretary and one of your health and safety reps. I just want a couple of minutes of your time to talk seriously for a moment. The week beginning the 14th of May is Mental Health Awareness Week as well as UCU Recruitment Week, and while I went up putting posters at each of the 7 campuses, I also put these posters up about mental health awareness, and I had some interesting conversations with some of the members. They were really insightful. I gained a lot from those conversations, and I think the members did as well. And I thought it's a shame we couldn't have had that kind of conversation as a whole group, maybe in a meeting, but it seems like ages since we've had a meeting. So I thought I'd put down some thoughts in the video. And hopefully this will help explain why mental health awareness is so important and why mental health is such a critical issue. So it sounds simple, but mental health is just as important as your physical health. I think the poster says it all. You've got how are you, fine, but then there's a lot of things going on in the mind of the person being asked, and I've been in that position. I've been that person that's been in the light blue on the poster. Talking about mental health is still a taboo for many. I think it's awkward. I used to think it was like a tornado or an earthquake or catching cancer or getting Parkinson's disease, something that happened only to a few people in society, and it would never happen to me. And I think that distance is almost like a coping mechanism for some of us, but we need to do better. As members, as a union, I think we really need to do better. We need to champion this, and I think we need to talk about it, and talking about it is half the battle, really. Okay, so what's this video about that you've clicked on? Well, it's a quick introduction to some facts about mental health. It's some tips for talking with colleagues regarding mental health. Having that conversation is really crucial, and it's some advice on where you can turn if you are experiencing mental health issues yourself. And I'll do this as briefly but as to the point as I can. Okay. So here are 7 clear facts about mental health. Most of these I've got from mind.org, as well as The Guardian and other places. So 1 in 4 adults will experience a mental illness at some point each year in the UK. This ranges from anxiety and depression to alcohol dependence, substance misuse and psychosis. More than 55,000 suicides occur in the European Union each year, including more than 6,000 in the UK and Ireland. Suicide is the leading cause of death among young people aged 20 to 34 years, and in the UK, and it is considerably higher in men, with around 3 times as many men dying as a result of suicide compared to women. It is the leading cause of death for men under 50 in the UK. Those at highest risk are men between 40 and 44 years who have a rate of 23.7 deaths per 100,000 population. In England, women are almost twice as likely to be diagnosed with anxiety disorders as men. Aerobic exercise, such as using a treadmill, walking and cycling, performed for 30 to 40 minutes 3 times a week for at least a 12-week period, was effective at improving mental health outcomes in people with schizophrenia. Bipolar is the 4th most common mental health problem worldwide after depression, anxiety and schizophrenia. In 2013, depression was the 2nd leading cause of years lived with a disability worldwide, behind lower back pain. In 26 countries, depression was the primary driver of disability. And I think we often forget, or a lot of you won't realise, that any health issue, be it physical or mental, that lasts for more than 12 months or may seem to last, projected wise, for 12 months or more, counts as a disciplinary under the old DDA, Disability Discrimination Act, and the new 2010 Equality Act. We forget that mental health is covered by disability within the Equality Act. It's easy to just assume it's a completely different. Okay, so a little disclosure here. Why am I talking about this? Well, one is because I did feel that this is something that needs to be championed by one of the reps. As a health and safety rep, I've thought I would volunteer to do this, and it's something that it's only going to come around once a year, Mental Health Awareness Week. So that's partly why I'm championing this. But the other reason why I'm championing this is because I myself suffer from mental health issues. It's not something I've disclosed, but I thought I'd disclose it now to get the ball rolling, because it's someone's got to put their head above the parapet and basically open up the conversation. And I'm inviting you to talk to me. Maybe that would help other people then feel more open to discuss things. My mental health issues have manifested recently in anxiety, depression, and feeling suicidal. 8 months previously, I'd never experienced any mental health issues at all. As I said earlier, I was one of those people that felt that, well, it'll never happen to me. My triggers, well, I experienced 3 bereavements of very close family members and friend. I had stress and relentless bullying, and like everyone, it's like a cup. 2 of those 3 I could cope with, but all of it together, it was the straw, particularly the bullying. That particularly pushed me to a point where I was at the lowest I'd ever been in my life. And my lowest point, I had decided to take my own life. I'd planned it, and it was the intervention of a friend that saved me. So I know support works. I would not be here talking to you today on this video had support not worked for me. And I think on a risk assessment basis, if we look at the highest risk, without trying to rate mental health issues, because we can't do that, that would be really silly, but rating risk such as suicide, self-harm and other things, support really does play an important role, as do friends. The road back to mental wellness is a long one. If you want to ask me more questions, feel free. Yes, I've been on medication. Yes, I've been with counselling, and it's all part of a bigger picture, and it does help. But not every person will respond to the same treatments in the same way, obviously. So what I've done is I've put together some tips for supporting colleagues with mental health issues. I originally wrote this as don't avoid them, don't ignore them, don't isolate them, and I realised that it was almost them felt a bit like saying it. It almost for me anyway, reading it back, it seemed like I was making a level of separation between the colleague reading this and the member that may be experiencing mental health issues. So I put myself in the position. So I've put me, use me as the example. So when I've said me, you can practice on me. You can use me as your example for this. So I'm not being narcissistic, but I thought them sounded a bit impersonal. So don't avoid me, don't ignore me, don't isolate me, don't ostracize me, don't treat me different, don't gossip about me, don't listen to rumors about me, don't pressurize me to relinquish my roles. Part of the road to recovery with mental health issues is being able to step back into life. And barriers to that actually are really damaging. Don't compare tragedies, bereavements, or issues. It's a no-no in counselling. It's one of the golden rules. You don't compare. If somebody says, I lost a partner, or I've had a family member pass away, or an illness, it can be even the death of a pet. Do not compare with your own tragedies, even if you've experienced almost a similar thing. We all have different levels of resilience and different levels of strengths and weaknesses. Don't compare. It really doesn't help. Don't replace me. Again, in work, that works really much. If you imagine in a workplace, don't replace what I'm doing. Don't forget, I never asked for this. Don't take away my route back to normality. There's a lot of don'ts there, but it is important. Do be kind to me. Do be patient with me. Do talk about my mental health. Unless somebody says they specifically don't want to talk about it, it's fine to bring it up. It's as I said, it's like a taboo that we put in place without really thinking about why we do that. Do keep on respecting me. Do ask how I'm doing. Do listen to me. Things can escalate quickly, especially coming from a point of view of anxiety, depression, and suicide. Being suicidal, you can actually have a kind of almost like a spiral. You have a thought and it goes around in your head, and you're not telling anyone how you're feeling. No one's asking, no one's listening, so it can be very quick. It can escalate to quite harmful thoughts. Do just be there to remind me of who I am. Friends and colleagues are really important on the road to recovery. Yes, some people respond well to drugs. Yes, some people respond well to counselling, but really when someone is trying to continue their life and trying to get through this barrier of mental health, they need those support networks that were in place beforehand to remind them of who they are and who they currently still are, really. Right. There's a really good website. I've actually got a set of websites I'm going to put on the Padlet with this. Mind.org.uk has an excellent PDF on managing conversations about mental well-being, and it really pushes to have that conversation can mean the world to people who are suffering mental health issues. Other tips, mentalhealth.org.uk. Obviously, they're promoting Mental Health Awareness Week as well. For those looking for support, it's a good place to go. There's actually a find out your mental health score. It's more serious than it sounds. When I've said it out loud like that, it sounds flippant. It's not. It's not trying to be a computer diagnosing you. It's not a computer psychologist. But what it does do is it gives some nice advice, and it allows. It's an interesting measure of stress, to be honest, because we can't forget that stress is also part of mental health. I had a look at it and I thought it was interesting and useful. Other things, Birmingham Healthy Minds, this is the one that the doctors will recommend to anyone that goes to speak to a doctor about mental health issues. You can self-refer yourself to counselling here. There's also an interesting bit on depression and anxiety. Another one is the one for UCU members. As a UCU member, you have access to this, so why not use it? The Education Support Partnership. It says on the screen, counselling support, financial assistance and more. They are brilliant. You can text them if you don't want to talk, if you can't get the courage to talk to them. I recommend this, personally going through this, text them. If you can't talk, you can email as well. Finally, I just want to say, look after one another, and you are not alone. It's really easy to feel isolated. It's really easy to feel that the world's against you and that you've got no other escape. Particularly talking from a point of view of depression, stress, and suicide. Don't let yourself go there alone. There are people that want to talk to you. There are reasons to carry on. Thank you for listening, and yeah, I think that really mental health is a really important aspect to one of the stresses, one of the dangers of life, but also in the workplace, and it's really important that we look out for one another. If you are experiencing any difficulties at all related to mental health issues, and remember, this can start with what people for some reason see stress as very shallow end, and then they'll see the typical disorders from the textbooks as a deep end. Regardless of depth, speak to a rep. Talk to me, you can email me, you can email any of my colleagues. Do not suffer alone. If you don't want to talk to us, look at one of the phone numbers and websites that I've offered on here. Please do not suffer in silence. And for those that have colleagues that are suffering or maybe may have mental health issues, please, what I was trying to say on this is don't treat them differently. They're not different. We're all in this together.